cause pain. But following stroke, if things become misinterpreted, those normal movements or normal sensations like pressure and heat and cold can be interpreted as pain.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
On that note, I'm going to go to a really, really interesting question here. Not that Sonny's question wasn't interesting either, but a good one here from Polly Hutchinson in the live stream here. Could you expand a little bit on the concept of maladaptive plasticity? And is it possible to have complex regional pain syndrome in stroke without pain? Interesting one. And I think let me first go to the second part first, which is it possible to have complex regional pain syndrome without pain? And let me first say that I'll actually post some of these resources in the chat as well. There's a really nice summary here from Harrison and Field. They did a big summary of clinical trials to evaluate sort of the proportion of individuals that had pain following stroke, and it's relatively high. It's a very underappreciated phenomenon, something on the order of between 30 and 60% of individuals, depending on which study and which population you look at. And I'll be sure to post these primary sources for you guys so you can have access to them. But fundamentally, no, Polly, you cannot have complex regional pain syndrome without pain. That is a sort of a definitional sort of trait. You have to have pain in order to be diagnosed with complex regional pain syndrome. So that's a fairly easy one. Now, there are different types of complex regional pain syndrome, and there are different sort of etiologies. Most commonly, they're associated with fractures, which is interesting, sort of these complex orthopedic injuries that induce changes, but it also happens following stroke. I think we've actually talked about this several times on Rehab Power Hour about thalamic strokes and how sort of maladaptive plasticity can occur and cause a misinterpretation of those sensory signals. And so that's a really good example of what happens when organization of the brain kind of goes awry in a simple sense, where these normative signals coming from our bodies become interpreted inappropriately. So under normal circumstances, if I press my hand here, or if I move, those wouldn't necessarily cause pain. But following stroke, if things become misinterpreted, those normal movements or normal sensations like pressure and heat and cold can be interpreted as pain. So I think that's a fairly simple concept of maladaptive plasticity in the sensory systems. It can be very, very complex in terms of changes in what are called interhemispheric dynamics. And that's becomes really into the weeds here.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
So we don't have the time or the bandwidth really to go into those. That would require many hours of discussion, most likely. As a quick follow-up to that, any sort of thoughts on this in terms of the maladaptive plasticity, or do you think the sensory example is a sufficient one to explain the concept?
I think what you said is absolutely correct. What makes this very confusing is that what creates these pain syndromes and then what might appear to be an overinterpretation of pain is a change in the dynamics of these inputs, which our brain doesn't know how to interpret. And that's not the same for everyone. And there are multiple factors that contribute to this perception of pain or our ability to treat it successfully. So suffice to say that it is a disconnection between what one would normally see as inputs that come into our sensory brain, the part of our brain that feels sensations, and the normal rates of pulses. And now the pulsing may change so that its nature is interpreted by us as being painful, often related to the region or the location from which it is coming. It's very difficult for us to treat that therapeutically. It's just really hard to do. The other thing I think it's important to add, Dr. Housley, that some people get confused. You're absolutely correct. There's a large percentage of folks who've had strokes who have pain, but a reasonable percentage of those is not necessarily complex regional pain syndrome, but may be induced by changes in our joint alignments, the most common being a subluxation of our shoulder joint because we don't have the strength to keep this bone in its socket in our shoulder, and that starts to pull and stretch the ligaments, which have a lot of pain receptors in them. And a large number of pain experiences in the upper extremity of folks who've had strokes are due to this phenomenon of a subluxed shoulder, because I don't think we might have taken the optimal care of how we position that shoulder joint, the bone within the shoulder joint.
Yeah, that's a good mention here, because we often will deal with appropriate positioning on with the use of these rehab interventions, and so it becomes a very salient matter for us. But oftentimes it's these problems are underappreciated. So I really thank Polly for bringing this up. I know we weren't able to fully get to all of your questions here, Polly, but what we'll do is I'll make sure to answer those questions in maybe a longer format, maybe in written form, and I'll be sure to provide all the citations so you can read to your heart's extent there. Well, what we'll do is we're actually going to go on. I know Lily had another question here about the thalamic stroke. I think we've talked about this before, so I'll be sure to link a video of Dr. Wolf and I discussing this as well. It's also a very complex neural circuit that integrates a bunch of different areas of information. And it's no wonder that when there's problems with that integration, we have these problems of misinterpreted signals. Okay, very good.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.